Hello everyone, I'm Dr. Clinton Orsini with Connect 33 Upper Cervical Chiropractic. Today we're coming back with another video on a patient with neck pain, but more importantly her primary complaint was numbness, tingling, weakness into the hands and fingertips. She did suffer from this on both sides, so let's go through her case and find out what I did to fix her up. Let's go right into it.
All right, here we are looking at this patient. This is a lateral cervical x-ray or the picture from the side of the neck. To get situated, here's the eyes, the nose, the mouth. This first vertebrae is the atlas, the little bone up top we often talk about. These little BBs that you see are BBs I placed on the patient. This marks the bottom of the earlobes. This notes the bottom of the temporal mastoid part of the bone. This is the second vertebrae, the axis. And here are the rest of the cervical vertebrae, or your neck bones underneath it, 3 through 7. What we noted on this patient or x-ray is that there's a straightening of the curve, but there's clamping right here at the C5, C6 region, as well as some bone changes, what we may call bone spurs on other patients, but we just call it changes within the bones. We're just noting this little area, especially because we already know that this patient suffers from numbness, weakness, and tingling into the hands. This is a very commonplace and susceptible area that can produce those types of issues. So we flexed her head down, and normally there's supposed to be a nice C-shaped rolling curve. In the middle of the spine, we see that C6 is not moving properly. The rest of the vertebrae seem to move just fine. C6 is the problem child. With that vertebrae not moving properly, that's what's realistically causing the disc changes right here, and also the alterations in the bones, which we called earlier as potential bone spurs. This was the primary complaint on this patient. This was the area of the spine that was producing the vast majority of her symptoms, again being numbness, tingling, weakness into the hands and fingertips. When she flexes her head backwards, we just noted that the upper back vertebrae, the T1, is not closing properly. We worked on T1 and T2 on this patient, and upon further review, we may need to work on C3 at some later date, but as of right now, we haven't needed to do so. Again, her primary complaint going into the hands was caused due to the C6 vertebrae. The reason that she can hold her alignment and stay so well is because we got her head on straight. So this is a picture of the alignment films. The first picture called the vertex, where we're looking at the top of the patient looking straight down. And there is the patient's eyes, the nose, the mouth. This is the first cervical vertebrae, the atlas we're talking about again, where we can see the rotation of this vertebrae. This patient's atlas is rotating forward on the left side about 1¼ degrees. Doesn't matter how much it is out of alignment. We're just looking for a factor in which we can then correct. From this x-ray, this is the frontal picture where we get to measure this patient's alignment. This was another primary complaint or issue in this patient. On this patient, what happened is that the atlas rose up on the right side, bringing the skull with it to the left. In a normal patient, if your skull leans left, the brain wants to shift the rest of the spine to the right to keep the eyes on top of itself. That didn't happen in this patient. As the atlas went up, the skull tilted left, the rest of the spine tilted more off to the left side, creating a lot of angulation and pressure within the neck and also into the low back, which is what we evaluated at a later point in time. On this patient, we did have to come from a high point of view, putting our force into this superior axial surface, or the surface that I'm pointing to right now, to prop the head and neck back up over itself so the spine would sit on top of itself. This not only reduced the pressure off the brainstem and associated nerves, but then because of that, the muscles get to relax, helping further help the patient with how they feel. Lastly, we did take a picture of the low back and pelvis region. On this x-ray, this is the front to back picture of the low back. We see that the hips are lower on the left side. The femurs are about level or slightly low on the left side, but more important, the spine is shifted off to the left side. It's all twisted going off to the left. These tails are rotated more to the right, or the bodies of the vertebrae more to the left. We know that this is a left SI joint issue due to all the factors we just spoke of, but we did want to confirm on this patient. So we leaned them to the right, and we saw that these little tails all move off to the right side, indicating that the right side is clear. We move them to the left, we see that these vertebrae tails don't cross back over. That's how we can confirm that this is a left SI joint issue, because if this SI joint moved clearly and these vertebrae were able to move, these tails would cross over to the left side, just like what they do on the right side when they lean right. So that's how we confirm, and we know that this is a left-sided issue. We took a picture of the low back from the side. Nice curvature on this patient. Some slight degeneration at the lowest disc region. However, that's very common in a lot of people, especially if they have a misalignment like this. So this is the primary issue actually in the low back, just addressing this left SI joint region. And then any associated lumbar vertebrae that don't cross over to that side, we just monitor and check at future visits. However, again, the primary issue on this patient producing numbness, tingling, weakness was mostly due to the mid-neck issue, the C6 vertebrae. After we adjust this patient, they always tend to do better. They only need to show up about every 8 weeks on average. Sometimes she can get away with 3 months as well, which is of course 12 weeks. But generally speaking, she does really well if she's just seen and gets the C6 worked on every about 8 weeks for her. The reasoning that we can keep her away from the office for so long is because she does a great job at holding her alignment. She keeps her head on straight. As we keep this pressure off the brainstem, the muscles are pulling normally from front to back, side to side, so that allows this vertebrae to stay in motion for as long as possible. As opposed to traditional chiropractors, the brainstem will still be telling these muscles to pull abnormally, which requires a lot more visits and more maintenance. So, if you enjoyed this video, I'd ask that you press like. You can even press subscribe if you want to see more videos just like this. I apologize I haven't been uploading. I've just been really busy with patients, as you can assume. So, otherwise, you all have a great day and keep your heads on straight.